Next is to speak is Wendy Moulsdale, and Wendy is a pediatric nurse practitioner out of Sunnybrook, and she's been working with the network, training health professionals, doctors, first-line health people on this need to bring some best practices in terms of helping mothers. I know you've been doing some incredible groundwork all over the place, Wendy, so thank you, and would you go ahead then?
Thank you. Good afternoon, everyone, and thank you, Mr. Cole, for the opportunity to support the Pregnancy and Infant Loss Awareness Research and Care Act that I am confident will enhance the care of women and their families in Ontario who experience pregnancy loss and infant death. PAIL Network is also looking forward to collaborating with you and with the Ministry of Health and Long-Term Care. I believe that this bill is an important step to begin to share our 25 years of collective experience, knowledge, and clinical best practices to help establish standardized care for families across the province. And thank you, Michelle, for your powerful and inspiring words. As a nurse practitioner, I have personally supported hundreds of families experiencing the loss of a baby to stillbirth or neonatal death, and I have taught more than 600 healthcare professionals across this province about how to provide compassionate bereavement care to women and their families. I believe it is crucial that we make pregnancy and infant loss a priority healthcare issue. As Michelle so poignantly described, when a parent loses a baby, a long and emotional journey of grief and loss begins. And while grief may change over time, the loss and the pain remain. Certainly the first step towards trying to find answers is to raise awareness about this widespread medical reality and to conduct more research into the reasons why 1 in 4 pregnancies end in loss. But while we search for the answers, what we can focus on is helping the families now and educating professionals, including doctors, nurses, social workers, midwives, ultrasound technicians, doulas, funeral home directors, and so many more who come into contact with these families. They do already call PAIL Network year-round for training and advice about how to deliver compassionate care to those who are suffering from this tragic and traumatic loss of their baby. And we provide them with that knowledge and best practices about how to support families experiencing loss, how they can work through their grief, how to communicate with families in a caring and sensitive way, and to provide some awareness about the resources that are out there. So as the lead for education for PAIL Network for the past 2.5 years, my team and I have worked tirelessly to reach healthcare providers all over the province with a key message, and that is, when we know better, we do better. But sadly, as we've traveled the province, we continue to hear sad stories like these. A 38-year-old mother is lying in her hospital room grieving the stillbirth of her baby girl when the nurse walks in and asks, "Why aren't you with your baby?" We want this to stop. Or a 30-year-old woman who walks into the emergency room with severe abdominal pain and bleeding, and she tells the staff that she's pregnant. And the doctor says to her, somewhat nonchalantly, "Oh, you're probably miscarrying. It happens all the time. We'll send you home with a kit, and you can always see your own doctor next week. You can always try again." We want this to stop. A bereaved couple whose first baby died at 23 weeks gestation, and now they are in a subsequent pregnancy. They've come to the clinic for an ultrasound, and the ultrasound technologist comes into the room with a happy expression on her face and says, "Oh, hi, is this your first baby?" We want this to stop. A key component of this bill is to support women and their families experiencing these tragic circumstances, and to achieve that, there is an urgent need to educate healthcare providers all across the province. PAIL Network has brought our programs across the province to both large and small communities, and we know we're making a difference now, but there are so many more we need to reach, because thousands of families don't know where to find help, and they are so desperately in need of that help and support. The feedback from our workshops has been overwhelmingly positive. Healthcare professionals feel much better prepared to care for bereaved families. They have the tools to talk to families, to help them learn about their emotions of loss and grief. And they recommend our program to their colleagues. But there is still that gap out there, and we do need to do as much as we can to reduce the suffering that goes on. More communities need to hear our message that families must receive sensitive and compassionate care, and that care needs to be informed by the best evidence and knowledge about the impact of grief and loss on the lives of the parents and the lives of the family and siblings. And we know that contact with these families goes far beyond hospital walls, and we sincerely hope that this bill will be a catalyst for change. And in closing, I would like to reiterate again to remember that when we know better, we can do better. Thank you very much.
Yeah, thank you so much, Wendy. And as you said in a very compelling fashion, is that sometimes the callousness and the lack of awareness is quite shocking in our modern, state-of-the-art healthcare system. That we still have this double standard and these gaps in our healthcare system, and I don't think it's it's not a malicious thing, but it seems to be just a total lack of appreciation of this. I mean, that's what I've been finding, is they just don't understand. Like, I know we contacted a health reporter about this initiative today or the other day, and they said, well, this is not really a health issue. This is a lifestyle issue. And this was a major health reporter. So, and I don't blame them. I mean, this is something that, they talk about the glass ceiling, but, I think we've got a real, almost a organized silence about this that needs to be broken, so that we start dealing with it in a comprehensive way to allow people to understand this without being afraid to speak about it. So thank you so much.